Good morning, everyone. Welcome to the Parliamentarian and Civil Society African Dialogue on the urgency to protect the cure. We're going to just wait for 5 minutes because many people are still joining us. So thank you all for being here, and we look forward to have a very productive conversation. I hope you can hear me well. Welcome to our Parliamentarian and Civil Society African Dialogue on the urgency to protect the cure and address malaria resistance. So we are happy today to have a full panel of great speakers, and we're going to get right into it. But before that, for logistics, we have the translation. If you speak French, you can use the translation. And let us know in the chat if you have an issue, but you should be able to speak French and Portuguese. So I would like to next get right into our full agenda, because as you know, we are in really a critical situation in the fight against malaria. You may be aware that the resistance is growing, and we're going to talk about that today, because it's really a threat for our existing tools, making them less effective for certain tools, and making it more urgent to develop and deploy new diagnostic treatment innovation, but also use existing treatment in a different manner, a manner that will address resistance. So we will start by assessing the situation of malaria today, where we are in the fight against malaria. And we thank the World Health Assembly, the WHO, malaria program for the 2025 report that have highlighted some key information that we're going to learn from today. So I'm happy to please call on Dr. Arnaud Leménage. Dr. Arnaud is the lead author of the World Health Organization Malaria Report for 2025. So we will pass on to Dr. Arnaud, and Dr. Arnaud is going to brief you on the malaria situation today from WHO. Thank you.
Thank you very much for the invitation. Can I confirm you can hear me okay? Thank you very much for the invitation and the opportunity to discuss the World Malaria Report and for organizing the webinar. I will be speaking and provide a bit of an overview of the World Malaria Report, and then open up to the discussion. And I will introduce Arnaud Leménage, and I'm the unit head for the Strategic Information for Impact at WHO for malaria and for NTD. Let me share my. I wanted to share my screen, but I don't think I should be able now. Yes. Okay. So just wanted a little bit to provide an overview to shape the conversation around the World Malaria Report for 2025, which reports information from 2024. There was a special chapter this year, which was focusing on addressing the threat of antimalarial resistance. So when you look at the situation of malaria worldwide, we can see that malaria remains a serious global health challenge, impacting the most vulnerable population. In 2024, we estimated about 280 million cases affected by malaria and more than 600,000 lives in 2024 alone. And when we look at the distribution of the burden worldwide, we can see that approximately 95% of the cases and the deaths are reported in the African region. And actually, when we zoom even more, we can see that 11 countries account for about 2/3 of the global malaria burden. And you can see on the right side of the slide, the trends. In blue, it's the trends for malaria incidence, and in dark pink, the trends for mortality rate. And what we notice is that while there was like progress over the last couple of decades, we can see a bit of a bit of stagnation, I would say, over the last like, couple of years for incidents, while the mortality rate continued to decrease. What's important as well to remember is that all the effort and the funding that has been invested into malaria had a measurable impact. So we estimated that about 1 million deaths were averted in 2024 alone. So we can see that despite the high burden and the serious public health challenge of malaria, we can see like progress and we can see the impact of the investment and the work of the National Malaria Program. Those health gains are really enabled by both international and domestic funding, and we estimated about a third of the funding for malaria coming from endemic countries. Beyond that overall view of the burden, here we can see there are a couple of like key threats to malaria, mostly biological threats, so that includes antimalarial drug resistance or also insecticide resistance. And what we can see here on the map is the countries that have reported confirmed antimalarial resistance or suspected as well. And so we are in a total of about 8 countries that reported either confirmed or suspected partial antimicrobial resistance, which has an impact on the effectiveness of the treatment. There are a couple of other threats, health system conflict, environmental vulnerabilities as well, which will reduce the coverage of the intervention, but also like disrupt the health services, whether like it can be like climate change or it can be like a conflict. And one of the key threats that we're all aware of last year, it's really a significant reduction in official development assistance from major donors. And when we look in 2024 number, funding was estimated for malaria a little bit less than 4 billion, which is half of the required target. So what is being done to address those challenges? First, we can see there is still a widespread deployment of malaria co-intervention. So here we're talking about case management, ITN, cable prevention. And despite the fact that some coverage gap remains in some region, we can see like a more wide implementation of those tools. SMC, for example, was implemented in 20 countries in 2024, reaching more than like 54 million children. We can see as well a shift towards more effective tools. So the new generation of ITN that would be more effective in places where insecticide resistance has been detected. Like the share increase actually from 9% in 2019 to 77% of all the ITN being shipped in 2024 worldwide. And finally, like you can see also like on the map, the malaria vaccine has been introduced in 24 countries as of October of last year. And here on the map, we can see where the countries that have implemented the malaria vaccine, either at the national level, or countries that are planning to do it as well, which are a country now in green. So what is needed now? I would say what we're facing is really both like a plateau in terms of the malaria burden, but also like severe like resource constraint environment. So there are a couple of like pieces that would like be key to address those challenges. First is like to continue to strengthen the political commitment towards reducing malaria burden and towards elimination as well. And maintaining it at all different levels, so at the political level, but also with engagement of the community under the national leadership. There are also like a needs to continue the development of like new tools. So thinking about like R&D, being able to really develop more effective tools, especially like when we think about the risk of resistance, but also being able to implement effectively those strategies in a cost-effectiveness way, and using actually like the surveillance data from the country at a very local level to be able like to inform those strategies. And finally, it's also like rethinking the funding situation, being able like to foster more sustainable financing and health system mechanism, being able like to prioritize domestic financing, but obviously that needs to be also supported by a global ecosystem of solidarity and led by the country leadership. So that was really like a quick overview of the World Malaria Report, and looking forward to the discussion. Thank you very much for your attention.
Yes, thank you very much, Doctor. I hope you can hear me well now. Merci, Doctor Arnaud. Merci.
It's better now, yeah. Now we can hear you.
Great. So my name is Olivia, and I'm here. I'm pleased to be here organizing this webinar with several partners, including Temple University, Normal Life Pictures, WHO, MMV, COPEMA, CS4Me, etc., and also RBM. So we look forward to this conversation, and thank you, Arnaud, for setting the scene. As we understand, from the World Malaria Report, we have an increase of malaria cases, and we also understand the risk and the danger of growing biological resistance that could potentially threaten malaria prevention and treatment. So we appreciate your presentation, and I see that everyone is asking already on the chat if they can have your presentation. Yes, of course, we will send it to all of you after the webinar, but importantly, we hope that you will be able to share the information in your countries, with your network, with civil society, other parliamentarians, all the actors that are engaged in malaria, so that we can have the right information about the situation we are in. So in this context today, is a critical point in the malaria fight. That's why we chose to host this webinar, to start to continue those dialogues on malaria resistance, because we think it's very important for African leaders and actors to get together and ensure that the WHO guidelines on malaria resistance becomes actually actions at the country level and help us to prevent those threats and those resistance. So we know that we are facing a continued spread of insecticides and drug resistance. And we also know that in this moment, we have complex environment in urban area, climate change issues, conflicts, and many other factors that actually increase those risks of malaria resistance. But there's a solution to every problem, and we look forward to have the conversation about what actions African leaders and African actors will do to address that problem. So thank you very much, Dr. Arnaud. For everyone who have questions for Dr. Arnaud, please write your questions in the chat or in the Q&A, and we'll make sure to open a few minutes later on for discussion. So thanks again, Dr. Arnaud. Now we're going to go on to the next item agenda. And we're going to hear a message from Dr. Charles, the CEO of the RBM Partnership to End Malaria. So Dr. Arnaud, if you can stop sharing your screen, please. Thank you very much. And now we hear Dr. Charles. Thank you, Ugo.
Good day, ladies and gentlemen, parliamentarians, civil societies, colleagues, friends. It's a great honor to be able to address you today on this very important topic, protecting the cure. Before I start, I would really like to thank CS4Me for organizing this very important dialogue, a dialogue that is coming at the right time in terms of our own collective roles in protecting the cure. Allow me to say a few words from a medical perspective. Being a medical doctor, having practiced in my own country of Nigeria at the height of chloroquine resistance, I saw the impact and the devastation that this had on communities, on families, on the health system. We had many cases coming into the hospitals. We will treat them, they will not get better. This had an economic cost to it. It also had an emotional cost to it, and it devastated many families. And the world came together and said, never again. But unfortunately, never again is happening again. We're seeing more and more countries, recording partial artemisinin resistance. We're seeing that in Eritrea, we're seeing that in Uganda, in Tanzania, in Rwanda, as an example. And I'm sure they're happening to some extent in other countries. That is why we need to come together and see what can be done. We've made remarkable progress when it comes to malaria over the first, since 2000 to 2015, but we've also seen a remarkable decline when it comes to cases and deaths. In the 2025 World Malaria Report, we saw that we had around 282 million cases of malaria and about 610,000 deaths. Now, these are cases and deaths that shouldn't be occurring. One of the factors that is driving the cases and deaths is exactly what we're talking about today: anti-malarial drug resistance. So what can we do about it? There's a lot that can be done from ourselves as a collective, as the ecosystem, but I really want to focus on yourselves as parliamentarians and the civil society organization members that are here today. From a parliamentarian perspective, we need you to support us in terms of legislation that can move us in the right direction. As an example, we have many cases, many countries, many individuals still having fever and immediately taking antimalarials. We need to move away from that. We need to ensure that anybody that has fever is tested, and if they are positive for malaria, then they're treated. And once they're treated, then they should complete their doses. That's why parliamentarians, civil society have to work together to ensure we get it right. Protecting the cure also means that we need to move away from looking at ending malaria from a health perspective, but we need to look at it from a whole of society perspective. We need everybody on board. We need to protect the gains we've made. We need education to come in, infrastructure to come in, the Ministry of Agriculture to come in. We need every single person to help us protect the cure. But protecting the cure has to start with us as individuals, as communities, and then as the nation, and then as the continent and as the globe. If we do not play our part, we will not be able to protect the cure. So I urge all of us, as we deliberate in the next few hours, to see what can we individually do, what can we collectively do, and what can we do as a society. We know ending malaria is certainly possible. We've seen it last year, we've seen it the year before. We have over 47 countries and 1 territory that are malaria-free and have been certified by WHO. Recently, we saw Egypt being certified, Cape Verde being certified, Georgia, East Timor being certified. But from an African perspective, we also want more African countries to be in that race. So I urge all of us, let's get going, let's protect the cure, and let's make sure that individually, collectively, and as a nation, as a continent, as a globe, we are reducing anti-malarial drug resistance. It can be done, and I end by saying zero malaria starts with me, zero malaria starts with you, zero malaria starts with all of us. It is possible in our lifetime. Let's not reverse the gains that have been made. That will be devastating to the many lives that we could lose. I thank you.
Okay. Thank you very much. Thank you, Dr. Charles, for your key message. We understand that as civil society and parliamentarians, we have a key role to play to ensure that there's a strong community engagement, especially with the compliance of malaria treatment, making sure that communities who are given treatment take the full course of treatment and not half of it when they feel better, because this is also a factor of resistance. So complying to the instructions of the medical doctors and nurses is very important to address that malaria resistance, and engaging communities and the population around those rules are very important. So thank you, Dr. Charles, for your message.
So I would like to give the floor to Nafisa from OFIF. Speaking of CSOs, it's a civil society organization working to improve health in Cameroon.
Thank you, Olivia. I'm Nafisa Tame, an executive director of WOWI, Women Organization for Worldwide Islam. And I'm also an active member of CS4Me from the beginning. And I'm also a representative of country coordination mechanism. I would like first to thank Dr. Charles because he has said something that touched me. I'm a community member. I work with community members. He has said something that's very important, that we need everyone. We need everyone in this fight. We need everyone to put their knowledge together to resolve these difficulties about the drugs, about everything that we have been talking about. Thank you, Dr. Charles, for your word. Now, I would like to introduce Mr. Andre, Dr. Andre Tracheux, Andre-Marie Tracheux. He's a head of Global Medical Affairs, Medicine for Malaria Venture. Dr. Tracheux has over 20 years of experience in healthcare access across Africa. Also in the Medicine for Malaria Venture, he leads strategies for malaria chemoprevention. He holds a medical doctorate and advanced training in health, economic, and system strengthening. Thank you, Dr. Tracheux, for your words. You have the floor.
Can you hear me?
Yes, we can hear you clearly. Thank you, Dr.
Okay,
Andre,
perfect.
for taking the time.
Yeah, so I was saying thank you very much to associate MMV to this webinar. It's always a pleasure to be associated with activities addressing the community. So it's a pleasure for me to be here once again. Yes, it's really a pleasure, and definitely with this situation of anti-malaria drug resistance, there is a need to provide solutions, and one of the solutions is to get new drugs available for tackling this artemisinin resistance, and provide solution to doctors to continue treating patients. So what is MMV? MMV, it's a Medicines for Malaria Venture, and it's a Swiss-based non-for-profit organization with a mandate to develop new drugs, effective and affordable, to provide anyway solutions, as I say, to treating patients. So in a situation like this one with artemisinin resistance, definitely people will turn to MMV to request what should we expect coming from you guys to continue provide a solution to continue treating people. So we are working towards a malaria-free world with a strategy in 4 pillars: curing patients, preventing infections, eliminating malaria, so providing solutions in these aspects. But beyond malaria, as a 4th pillar, we are also looking at how the systems are organized, how the tools and processes developed by MMV can be harmoniously used on the field. And also we have some cross-cutting priorities like improving availability, accessibility, and affordability, embracing equity, supporting climate and adaptation, and driving excellence, impact, and equitable partnership. So this is how we are organized. And this is the strategy that is supporting most of our interventions today. When we talk about resistance to anti-malarial, when you look at the history of the anti-malarial drugs that are out there, looking at artemisinin resistance specifically and the mutation on the Cache13 strand, so you could see that the first history of resistance started in Southeast Asia, in Cambodia in 2001. And then gradually it has evolved To get into Africa, the first report is 2013, and then it's becoming more and more an issue now. When we look at the partner drugs, amidaquine, piperaquine, mefloquine, pyronaridine, sulfadoxine, lumefantrine, and chloroquine, you could see that each of them at some point there was a resistance mentioned at some point in the literature, apart today from pyronaridine and up to 2024 lumefantrine as well. So when you now analyze the combinations, apart from artemether lumefantrine and pyronaridine artesunate, most of the other combinations have at some point showed some signs of partial resistance as it is defined today. When we look specifically on the map of Africa, how the resistance how the markers, the molecular markers of resistance to artemisinin is spread, and this is really based on about 1,700 studies. You could see that it's kind of spreading across the continent from east to west, but in the intensity of it differs from east to west. So it is more and more a problem. And Professor Matic Boni, who I think will be speaking here, say that if a country hasn't yet detected resistance markers, they are probably not just looking hard enough to detect it. So it must be somewhere, but you have to look for it to find it. And of course, you have to report as well, because this is based on published studies. Now, what could be the consequences of anti-malaria drug resistance in the public health domain? This could result, according to WHO estimates, in about 16 million additional malaria cases, 360,000 hospitalized severe cases, and about over 80,000 excess deaths per year, and an estimated cost of approximately $1 billion to the African continent. So this is the estimated consequences of anti-malaria drug resistance. If we reduce malaria cases by 90% by 2030, as per the strategy, the global malaria strategy today, this will firstly increase Africa's GDP by about 126 billion and boost the global trade by about 80.7 billion. So there are economic consequences of not managing anti-malaria drug resistance. And the malaria elimination will also generate a boost in export. So if we manage to eliminate malaria, definitely there are also some advantages. So the mandate of MMV is to provide solutions in terms of drugs availability. In the MMV drug portfolio today, of course, we work on this drug in partnership with manufacturers and so on. And our mandate is to make it available for the people who really need it. If we consider a time frame of 2024, 2026, so this year, what are the solutions that are provided? And this is completely in line with the WHO AMDR strategy. The multiple first-line treatment, so how to combine all the drugs available today to relieve the pressure on one single drug by using simultaneously all the drugs available, so that we can decrease the pressure and delay the confirmation of resistance. The introduction of triple ACT, so on the current ACT, adding one additional drug to be more effective. And the first in line is artemether lumefantrine plus amidaquine. The single dose primaquine added to ACT to fast track elimination. And then the introduction of the first non-artemisinin based combination, ganaplacide lumefantrine. The horizon 2030, sorry, around lumefantrine, we are building a triple combination, ganaplacide, lumefantrine, and sipagame, that could be available. We are working on it. And then there is another combination of carbamazepine and pyronaridine that is being worked on as well. So building around lumefantrine, but making sure that the next generation is not based around artemisinin as previously. And we are also working on a single dose cure combination. Today, most of the drugs, the ACTs, are three-day courses in 3 doses or in 6 doses. So we are working today on a single dose cure that will be coming in the future past 2030. And there is additionally, there is more than 6 potential molecules that we could add we could add or combine for novel combinations. The progress on non-artemisinin medicines, the non-lumefantrine combination, carbamazepine and pyronaridine single dose, achieved proof of concept in 2024. There are 2 more combinations that started evaluation for single dose cure in phase 1B and 2 studies. There is a promising outlook for the future with the first non-ACT combination, ganaplacide lumefantrine 3-day regimen, that demonstrated non-inferiority to artemether lumefantrine in phase 3 studies, and these were published at the end of last year. A first data set to inform the proof of concept for single-dose cure combination, and there is a strategy and option for backup, because in drug development, you always have to have a backup because we don't know what could happen in the studies. So you have to get backup solutions so that we can evolve, and those backup solutions are being selected, identified, and the selection process ongoing. On ganaplacide lumefantrine, therefore, that will be the first non-artemisinin combination available. In November 2025, together with Novartis at the American Conference of Tropical Medicine and Hygiene, the results of the phase 3 study were announced. So ganaplacide lumefantrine meeting the primary endpoint of non-inferiority to standard of care artemether lumefantrine. And if this is approved by the health authorities, the regulatory authorities at global, and then at included in the guidelines by WHO, all that process is ongoing to inform and so on for the drugs to be approved. If it is approved, it will represent the first novel acting innovation in the treatment of uncomplicated malaria since 1999, when the ACTs were introduced. So this will be the first non-artemisinin drug available, with the potential to be active against artemisinin resistance parasite and the potential to block malaria transmission. So a double effect. And beyond this, there is a transformative a triple combination, ganaplacide, lumefantrine, and cipargamate, that the phase 2A study is also underway. So this was just a brief summary to confirm that in the background, there is work to be done to provide solutions and to continue generating some hope and to move towards concrete malaria elimination. The situation, yes, it's a bit difficult, but there are solutions, and we should still contemplate the elimination we are all looking forward. Thank you for having me.
Thank you very much. Thank you. Bravo, bravo. Thank you, MMV. Thank you, Dr. André, for this presentation and also sharing some of the solutions, innovations that are coming up. So we really thank partners like MMV and others who are working tirelessly to bring innovation in the malaria fight, to find new solutions, and to ensure that countries are equipped to actually deploy those solutions. So thank you very much, MMV, Dr. André. And we also thank all the partners who have joined us, the CSOs, parliamentarians from Mozambique, Honorable Elsina, parliamentarians from Cameroon, Honorable Peter, welcome. Honorable Mposhi from GRC, Thank you for having for joining us. There are many others, parliamentarians and civil society that are here listening to all of you experts and also noting what action is required from parliamentarian and civil society. So we're just going to take a few minutes to look at some of the questions that have come up for WHO and for MMV. So we have first a question for Dr. Arnaud for WHO. So Dr. Arnaud, there's a question from Dr. Mvundi, which is from the malaria program based in Cameroon. And Dr. Mvundi is asking that about the prioritization. From WHO perspectives, what are the 2 or 3 no regret actions that countries with limited resources should prioritize now to reduce the risk of anti-malaria drug resistance? So this process about which intervention needs to be prioritized is a process going on in many countries at the moment, looking at the current context. So Dr. Arnaud, what do you think? Do you have any response to that question? Thank you.
Yeah, thank you very much for the question. I think it's a very important and relevant question, especially in the context of limited resources that everyone is facing currently. When we think about anti-malarial drug resistance, I think there are different like high priority interventions that should be considered, and Dr. André-Marie discussed like some of them already. But I think one of the key one is really about multiple first line therapy. So thinking about rotating the different first line to prevent the spread of resistance, and that's a key priority. I also think it's important to remember like where we should intervene in countries, and that's at the point of care, because that's where like the drugs are being delivered. So in countries, for example, where a lot of the drugs are delivered like through the private sector or other mechanism, I think it's important to target the intervention and to prioritize them in places where people like seek care, which means like discussing with provider, training of the providers, but also like means like regulation for example. And I think the maybe like the third piece, which is also key and important to prioritize, is being able to continue like surveillance for anti-malarial drug resistance. We only know what we survey, and so it's really key to be able to continue monitoring the situation to see if the problem of drug resistance is spreading, if it's emerging in new countries, being able to share those data. Because the experience of the GMS of Southeast Asia, they were the first one to see like drug resistance appearing. And there was like exchange of information, regional collaboration, involvement of like from the political commitment to the involvement of the community and of the provider. And I think that was a key recipe to really now they're nearly like eliminating malaria. So I would say those are like the really like key priority actions.
Thank you very much. Thank you, Dr. Arnaud. So while you're here, there's a second question for you. And this is coming from parliamentarians, Honorable Peter, the chair of COPEMA, the Coalition of Parliamentarians to End Malaria in Africa. So Honorable is starting by thanking you for your enlightening presentation. And he would also like to know how parliamentarians in Africa can receive the support from WHO in their political commitment, both to formulate the necessary legislation and policy that can lead to strong policy and sustainable financing for strong health system in Africa and also ending malaria. So the support that parliamentarians need to be able to develop strong legislation.
Yeah, no, thank you very much for the question, and that's very relevant. I think my main advice to Honorable Jume Peter it's really like to be able like to link with the WHO ecosystem in countries. So in every country, there are like representatives of like WHO who are here like to support the country, to support the government, that's the mandate as a member state. And as such, I would really like suggest Nora Plume Peter to really like liaise with like the country representative in Cameroon to discuss like the needs, to understand a little bit like the context in the ecosystem, to be able then to lead to stronger like, policy and more sustainable financing in country.
Yes, thank you very much. Thank you, Dr. Arnaud. And from the MMV experience, what needs to happen now beyond R&D, so research and development, to make sure that new treatments are introduced responsively and without repeating the past mistakes? So, Dr. Andre, that's a very easy question for you.
No, I don't think there is any easy question. You know, the system is complex, and from one country to another one, it's very difficult. I think what Dr. Arnaud said about MFT is true. Today, there are current available tools that are still working, because we are talking of partial resistance in some areas in Africa. So today we have to optimally use what is out there, and MFT is really the solution. When we look at the use of drugs today, I think 80 to 90% of malaria cases are treated by artemether lumefantrine, which is not normal. That is something that is increasing the pressure mainly on lumefantrine. So there is a need to kind of dispatch the pressure on the various companion drug to artemisinin that are out there. Now, for the introduction of the new drugs, we need to provide at regulatory level in Africa a way to speed up the registration process. Also, beyond the registration process, those drugs have to be included on the national guidelines. So once everything validated by WHO, because that's the starting point, WHO and the global regulatory agencies. I think at country level, we need to find mechanisms to fast track introduction of the drug in the country. And then at local level, this will be a huge change of paradigm, and we have to get the community ready to accept that, to understand the need of changing the new drugs, and be ready to accept that, having understood why those drugs are changing, why the new drugs are being introduced. So community engagement is very important to kind of lift the potential resistance that people will have about the new drugs, because they've been almost 20 years now. They've been using the same more than 20 years, by the way, almost 30 years. They've been using the same ACTs and so on. So now we'll be coming with something new. They have to understand exactly why and so on. And this is where the civil society, the communities and so on should step in to kind of channel the message down to the community to easily embrace those new drugs. I think I'll stop here.
Yes, thank you, Dr. Andre. Thank you for your message. We have noted that message for civil society and community and their roles. But with that, before you leave, there's another question for you, a quick one. Is question from MMV. What do you think is the role of malaria vaccine, the vaccine against, what role can the vaccine play against drug resistance?
Vaccine is a prevention tool. So at this point, we are talking of drugs for treatment. So what maybe the vaccine will do is that it will decrease, as is widely used, it will decrease the number of cases of malaria that will be exposed to eventually a failing drug. So it's definitely a key player. The vaccines are a key player in the overall strategy for malaria elimination, and they should not be neglected. So they are playing an important role for prevention alongside the chemoprevention interventions, the mosquito nets, the other vector control measures, and so on. Because we believe that there is no single bullet that will lead us to malaria elimination, and all those tools have to be used optimally to achieve this malaria elimination agenda. So the vaccine, they have their place. We know they are for the time being restricted to a lower age group, but if they are used optimally, they have a key role to play.
Thank you very much. Thank you, Dr. André. Thank you, Dr. Arnaud. You have many more questions in the Q&A section. Please, if you can take a look and then respond to all the questions. We're sorry we cannot go through all of the questions, but thank you very much to both of you for these very important and enlightening presentations. And we look forward to continue this dialogue. So we have noted your advice and your recommendation for parliamentarians and civil society, and we will make sure to summarize all of that and share with many others, CSOs, networks, and parliamentarians across Africa. So thank you very much again for your time. And so now you have heard about Protect the Cure. I'm sure many of you are wondering what that is. So Protect the Cure is a campaign, is a movement, is really a call for African leaders and actors to really act, to move into action to address these malaria resistance issues. So we are pleased to share with you an animated video about Protect the Cure, and throughout the webinar, you will get to see actually the first chapter of that documentary that we hope that you will share widely in your countries, in your network, in your communities, because everyone needs to see it. So now I will pass on to our partners, Hugo from Normalize Pictures, to share the video, animated video of Protect the Cure. Thank you.
In Africa, for the past 20 years, most of us have been using Artemether lumefantrine to treat malaria. Artemether lumefantrine, also known as ALU or Coatem, has served us very well during this period and has been highly efficacious for almost all malaria cases. This is changing, and it's important that we prepare. We are all very used to having a first-line anti-malarial drug. This will change, and we will soon have several first-line anti-malarial drugs, not just one. Some of these changes will be happening soon. What does this mean? Let's summarize in a few key points. Number 1, the anti-malarial drug that we use might change every year or every 2 years. This means that this year, you may be stocking and prescribing one artemisinin combination therapy, or ACT, but in 2 years, you may be prescribing a different ACT. Different ACTs may also be recommended for different regions of the same country or different age groups in the same region or country. So it will be important to stay up to date with the National Malaria Control Program's recommendations. You should check the national recommendations regularly and also take part in discussions through different platforms such as online groups of experts, colleagues, and implementers. This will enable you to stay updated about the changes in treatment guidelines and other relevant recommendations from the National Malaria Control Program. Number 2, inventory and stock management is now going to take more effort. We will all have to keep up with the national recommendations and know which drugs we currently have in store. And we're going to have to do more planning and timely forecasting on what drugs to order. We'll have to remember to order early, as drug orders sometimes arrive late. Number 3, we will always have to be mindful of appropriate dosage. When drugs change, weight bands change, and we will always need to remember to look up the correct dosage for a patient's weight. Keep all your posters up on the walls. There may be 3 or 4 new anti-malarial drugs introduced over the next 5 years. Number 4, talk to your community and talk to patients about these changes. They will have lots of questions, and they will rely on you to reassure them that this is all part of our new approach to fighting malaria. Let them know early, let them know ahead of time, and tell them to spread the word to their friends and family. Why are we making these changes? The answer is drug resistance. Africa has had several waves of anti-malarial drug resistance over the past 50 years, and a new one has arrived. Some of us remember how untreatable malaria was in the 1980s and 1990s. We are not going back to those times. We are preparing for this next wave of drug resistance by making sure the malaria parasite has many different drugs to fight. Our goal is to prevent drug resistance from becoming widespread. Is this approach strange or unusual? No. We're simply modernizing our public health systems to fight new threats. The best way to stay informed and to ask questions is directly through the website of the National Malaria Control Program or through colleagues working at the national program.
Thank you very much. Thank you, Hugo, for this beautiful presentation. This video that you have produced is really excellent. So we are very proud to partner with Normal Life Pictures and Temple University for the production of this video. So you will all receive the link of the video in English. There's a video in French and also in Portuguese. So we will share the links in the chat, and we will also send it to you by mail. But what we ask you to do is to spread those widely in your WhatsApp network, in your communities, everywhere. Share with as many people as possible, because information is key. And so we look forward to share those videos. So French, Français, Portugais, et Anglais is available in all those languages. So thank you very much. And so speaking of Protect the Cure video, I would like to introduce Masep, the Professor Masep Boni. He's from Temple University, and he's one of the main founders of the Protect the Cure movement. So Professor Masep is an epidemiologist with over 20 years of experience, and his research focuses on strategies to delay and anti-malaria drug resistance, including the implementation of multiple first-line therapy. So Dr. Boni also developed the Protect the Cure awareness campaign, and it's really hope that you will all learn about this threat, this risk and threat of artemisinin resistance in Africa, but most importantly, all act on it, and acting by sharing the information, raising awareness, making sure that everyone is aware and everyone can actually take action to fight that resistance. And we saw that there were some important questions in the chat. So Dr. André, Arnaud, Professor Boni, and others, we will share with you those questions around self-medication and its impact to malaria resistance, treatment resistance, and all those other factors. And we know that civil society here and parliamentarians can play a big role in mitigating those risks at the community level. So over to you, Professor, thank you.
Thank you, Olivia. And something appears to be wrong with my video, but can you hear me okay?
Yes, very well. We can hear you perfectly.
Okay, thank you. Well, thanks, Olivia. Thanks, everyone, for coming. It's a pleasure to be here to welcome you to this Protect the Cure event organized by Impact Santé Afrique, Normal Life Pictures, and Temple University in Philadelphia. As Olivia already mentioned, my name is Maciek Boni. I'm a professor of biology at Temple University, and my research for much of the past 20 years has focused on approaches to slowing down and delaying drug resistance in malaria specifically. As everyone on this webinar already knows, artemisinin resistance was first officially reported in East Africa in 2020. It has spread to 7 or 8 countries that we know of. And although artemisinin resistance has not yet been detected in West Africa, of course, it's important that we prepare for this. The World Health Organization has given us some of the tools to prepare and the guidelines on how to deploy multiple first-line therapies, or MFT, in a variety of different ways. And the aim here is to help slow down and delay the onset of artemisinin resistance, partner drug resistance, treatment failures. These are all the things that we're trying to slow down or delay. Each country and each national program will find its own way to carry out the best implementation of this approach. And one of the key challenges that we'll face during this time is communication. Changing malaria policy is difficult. The decision takes time. Informing colleagues takes time. And you all have colleagues that work hundreds of kilometers away or 1,000 kilometers away from the centers of decision making. And these colleagues will need access to the same exact information that you have. So for this reason, a little over a year ago, we set out, so that's Normal Life Pictures, Sketch Films, Impact Santé Afrique, we set out to make some communications materials to help everyone understand the importance, the personal impact, the community impact, and the potential solutions to drug resistance. One of the key messages that needs to be communicated is that artemisinin-based combination therapies have served us very well for 20 years. This is now changing. These drugs are beginning to fail, especially artemether lumefantrine in some places. And one important reason for this is that malaria parasites that are partially resistant to artemisinin drugs have begun spreading in large parts of East Africa. It's best to respond to this situation quickly, of course, and this means that a lot of treatment guidelines will be changing over the next several years. It also means that there are millions of individuals who need this information. What's changing, why are we doing it, and how we're going to succeed. So, to try to deliver this information, the creators at Normal Life Pictures have made several films on the challenges that we're facing. And we hope that you'll watch them. We hope that you'll distribute them to colleagues. The one that you just saw, that 4-minute animation video, that video is intended for community health workers, district clinic managers, dispensary owners, anyone who regularly sees malaria patients, but may not have regular contact with the National Malaria Program. We hope you've found that video helpful and instructive. And if there's any changes that you'd like or any additions that you think would be important for your context, then feel free to reach out to us directly. I would like to send a sincere thanks to Olivia Ngu, Segolen Musala for organizing the webinar and all the communications work they've done for the past year, and also to Hugo Barkley and Jeremy Rigol, who made all the videos. This has all been made possible by the tremendous effort that they have put into this project. So enjoy the remaining videos, please keep in touch, and let's keep this stream of communication active as our national malaria programs are making changes in the coming years. Thank you.
Thank you very much. Thank you, Dr. Boni. Thank you for your message, and we'll get right into the video. And thanks, Hugo, for playing the video. Thank you. So we all watched the Chapter 1 Protect the Cure documentary. And we will also share the links with all of you in the chat and by email. Thank you.
Just 1 second, sorry, they're coming right up.
Yes, no problem. And in the meantime, feel free, everyone, to continue to send your questions and comments and recommendations in the chat. because we are compiling and everything that we're going to put in a summary report of this webinar. So we have received already some interesting questions and recommendations and comments. So we'll make sure we compile all of those and we'll share them as well with all the experts who are here with us today. And just to give you an oversight of the agenda, following the chapter 1 of the video, we're going to have an exciting panel with key speakers that you don't want to miss. We will hear from the National Malaria Program of Tanzania.
We desperately need a new approach to treating malaria because anti-malarial drugs tend to fall like dominoes. So if higher levels of artemisinin resistance emerge, this will have a devastating effect on Africa.
Artemisinin derivatives form the backbone of malaria treatment in Africa. If we lose it, we'll end up with an increase in burden of disease and more deaths, and especially in the parts of Africa where the health system is weakest.
For uncomplicated malaria, everywhere now, we combine the rapidly acting artemisinin with a more slowly eliminated other anti-malarial drug. That's called artemisinin combination treatment.
If you get a malaria infection, the number of parasites in the body increases very fast. Artemisinin compounds quickly reduce the parasite biomass to a very low level. And once that is done, then you could mop out the residual parasite biomass over a period of time. The idea was to confront the parasite with 2 molecules. Each one of them hits the malaria parasite in a different way.
We recorded around 5 million cases in 2016. The number of malaria cases reduced up to 600,000 cases nationwide. In 2023, this was around 88% reduction. Severe cases also dropped to only 2,000 last year, which also around 90% reduction.
Partial resistance to artemisinin is defined as the failure of an artemisinin drug to achieve parasite clearance within 3 days, having taken a quality product and followed treatment guidelines.
Partial artemisinin resistance was initially documented in Rwanda and is rapidly evolving in Africa. The prevalence of mutant genes are increasing even from countries that were identified 10 years ago. Countries like Tanzania, Rwanda, Uganda, and Eritrea have confirmed the artemisinin partial resistance.
Drug resistance spreads. It spreads because people don't take the right amount of drugs, or the drugs are not given in the right doses, particularly when lots of people are receiving treatment.
What we are seeing across the East African countries is that point towards resistance is on the range of between 5 to 10%. And that is worrying because as much as we might not be seeing overt clinical treatment failures, we already know that is on the way coming if nothing is done.
Hey Yahweh, kumama.
90s, we experienced drug resistance to common treatments at that time, chloroquine. Children who were getting severe malaria, as well as pregnant women, were not recovering when given chloroquine-based treatments.
And I was there. In Kenya, when we were changing from chloroquine, we went down the expensive way of sulfadoxine pyrimethamine, or SP, and people continued to die. We advised that the next stage was not to switch to SP, but we were dismissed. It was not until the combination therapies came up in the early 2000, and then most African countries, including Kenya, switched off combination therapy.
I saw the entire transition from chloroquine to artemisinin derivatives, and I was in the thick of it. Everybody was fearing, oh, chloroquine is cheap, and we are moving into a drug that is not as cheap as chloroquine.
Right now, we have a window of opportunities that we have already seen partial resistance to artemisinin compound spreading, but it can still be contained. In other words, the idea is to stay ahead of the parasite. It's much cheaper, more efficient way of using the compounds we have now.
It's very important to urgently address drug resistance because we need to preserve their efficacy.
We see in Rwanda that people getting treatment but do not recover after 3 days. They receive it again for another treatment. This is a kind of a double treatment. And this is also doubling the cost of care, affecting also not only the country but also the funders.
The economic impact of malaria are enormous. First of all, the economic impact of losing so many children before the age of 5 is huge. It's huge. The economic impact of the time people take off to seek treatment for malaria is huge. The economic impact of the effect of malaria on pregnant women is huge. So taken together, the impact of malaria in Africa is huge.
Anti-malaria drug resistance is absolutely going to increase the economic burden to governments, but also to families. And that's why it is very important to protect the cure that we use currently, which are the artemisinin combination therapies.
Thank you very much. Thank you, Ugo. And we hope that you have enjoyed the first video, the first chapter of this very interesting and important documentary. So we actually have 2 other chapters that you can watch, and we're going to send the link in the chat. So we would like you, because of the sake of time and also issues with internet, so we would love for you to go online. They're all on YouTube. So we're going to send a link in the chat so you can watch the next content of those documentary. And trust me, it's very interesting. You will find it very interesting. So chapter 2 and chapter 3, you will send it in the chat. So please copy the link so that you can watch it on your phone, you can watch it on your computer. You can also share those documentary with your networks and with your community. Thank you very much. And we will get right into our panel discussions. But later on, before the end of the webinar, we'll come back to those documentary because there are some key actions that you have to do as civil society, as parliamentarians, as malaria program and other actors in health. There are some things that you have to do following watching the documentary, some simple action that you can do, but you can help save a lot of lives. So we'll talk about that towards the end of the webinar. So now I'm pleased to now introduce some of our panelists. But before our panelists, we have Honorable Elsina from Mozambique. Honorable Elsina, can you hear us? Honorable Elsina, if you can hear us, let us know. So we would like to give you the floor for a short message. Honorable Elsina. Okay. So we will try to reconnect with Honorable Elsina in a few seconds. But in the meantime, we will go and start our panel discussion with the expert that we have invited today. So we are happy to have Dr. Zeus. Dr. Zeus is the principal research scientist from the Health Institute at the National Institute for Medical Research in Tanzania, and is also from the National Malaria Control Program. So, and we also have Crystal Bihunji, which is a scientist from Target Malaria that many of you have known already from many of our event and panel. We are also happy to invite Emily from the Innovation Program for Community Transformation from Uganda, civil society. So Emily will share with us some of her perspective as civil society. But let's start with Dr. Zeus Ishongoma. Dr. Zeus, what are some of the lessons that can be learned from Tanzania resistance, monitoring, and prevention strategy? Dr. Zeus, over to you. Thank you.
Thank you. Thank you so much, Olivia, and thank everyone for inviting me. I'll be talking on behalf of the National Malaria Control Program, and I hope everyone can hear me. Can you?
Yes, Dr. Deus, we can hear you very well, and thank you so much for your valuable time. Thank you, Dr. Deus.
Thank you so much. So on behalf of the National Malaria Control Program and colleagues, I'll be sharing the experience of Tanzania on how the country is doing their best to protect the cure. So in Tanzania and other East African countries, the priority has been placed on ensuring that therapeutic efficacy studies are routinely conducted together with ad hoc or special therapeutic efficacy studies to generate evidence which impact policy and decision making as well as practice. But also in 2019, Tanzania made a deliberate decision to include malaria molecular surveillance in the surveillance platforms which we are using in the country. And from the data that has been generated from malaria molecular surveillance, basically, it helped make a decision. For example, in 2021, the studies showed that there is an area in northwestern Tanzania in Kagera that had artemisinin partial resistance mutations. What happened, WHO and NMCP worked together to implement a special therapeutic efficacy studies as a follow-up. That is the study which confirmed Tanzania as the fourth country in Africa to confirm artemisinin partial resistance after Rwanda, Uganda, and Eritrea. But also, Tanzania is making strong efforts to protect drugs which are used for protection, chemo prevention for children, pregnant women, and recently school children. But also in Tanzania, strategies have been made to develop standardized protocols, ensuring that drug resistance is included within the national surveillance system. And more importantly, Tanzania is among the few countries in Africa which have included malaria molecular surveillance as a key component of the national strategic planning or national strategy for malaria in Tanzania. And basically all the data that is generated from surveillance and malaria drug resistance is immediately taken into practice. So as I mentioned, after confirmation of artemisinin partial resistance in 2022, the actions were taken to respond, including more surveys as well as making the strategy to move from the currently used first-line drug, that is artemether lumefantrine, to ASAC, that's amondiaquine attesuate, but as a transition towards multiple first-line therapy. So in short, Tanzania has done brilliantly great in my experience with many African countries to ensure that efforts are made to protect the drugs which are used for fighting malaria. So I'll end here for now, and if there is any question, I'm happy to answer. Over to you, Olivia.
Yes, thank you very much. Thank you, Dr. Zeus. Thank you for sharing the experience of Tanzania as the fourth countries to have had malaria resistance, and also your concrete collaboration with WHO. So thank you for sharing that experience. Everyone, if you have questions, please, can you write them in the chat or in the Q&A for Doctor so that he can respond to the question later. And so I'm going to call now on Crystal Bihunji, which is the scientist of Target Malaria. So Crystal, can you tell us how African scientists and community engagement can ensure that malaria tools truly work for the people who need them the most? So how can scientists and community ensure that the tools that we have actually works? Thank you. Over to you, Crystal.
Thank you, Olivia. So I would say that in tool development for malaria control and for anything else really, it is vital that you have the people that are going to use the tool be part of the development of this tool. So malaria is an African problem. We have seen that in our presentation. Over 95% of the deaths are happening in Africa. And so it makes sense that when we're looking at developing tools or looking at innovation, for example, Target Malaria is working on developing genetically modified mosquitoes with gene drives that are aimed at reducing malaria spreading mosquito numbers in order to reduce malaria transmission and thereby reduce malaria itself. So when you're developing tools like that, it's really vital that you have African scientists on board, because this is really where the problem is. It serves a couple of purposes. One of those is that it ensures that what is being designed can actually work in an African context, because that's where we are, that's where we live. So, for example, what if you targeted a mosquito species that's not the species that is responsible for spreading malaria within Africa? So that is something that you can see when you're on the ground, that African scientists can really go ahead and contribute. Or maybe the behavior of the mosquitoes might be different from what is recorded in textbooks, for example. I'll give you a very brief example. We know historically that malaria mosquitoes bite between, let's say, around 9 p.m. to maybe 4 a.m. They're known as being nocturnal mosquitoes, which is why mosquito nets were developed. And they're known as biting indoors. But what we have seen is that in some places now, when we go on the ground, we find that they start biting at 6 a.m. all the way up to 6 p.m. all the way up to 6 a.m. when people are not yet in the net in some places. And in some places, they might be biting outdoors or even just resting in different places. So these are some of the behavior nuances that really make it vital to have people that have on-ground experience when developing some of these tools. This is not just for innovative tools. Even for the tools that we know are tried and tested and have worked for a while and are ongoing in this fight against malaria. So mosquito nets have been one of the most effective ways to fight malaria, in spite of the issues they've been having with resistance and so on. But we have found that maybe in some places, people will not sleep in a mosquito net because it is too hot. And this is not something that's being taken into consideration in the design of the mosquito net. Or previously when mosquito nets were all square, but people lived in round huts. So these are just some of the easy things that you can easily see if you live in the country that may not be so obvious when you're a researcher developing somewhere else. Another key factor is trust, building trust. If you do not have stakeholder engagement among the people that these tools are designed to reach, then there's a risk that you are going to have misuse of tools or even just refusal for the use of tools. We saw this with the COVID vaccine, where you have a vaccine available, but not really much involvement from African scientists or African communities in the development or even engagement of the communities. And then we have resistance to people for taking this drug. We have a lot of misinformation. So where there's a lack of information to stakeholders, it allows misinformation to grow, which stunts the attempt to reach elimination. For example, if no one is educated as to the use of the malaria vaccine, how to use, how it has been developed, how the research has been done, then it is difficult to reassure people that this is safe for their children, or even just how to do it properly. It can be as simple as that, just how to maintain a mosquito net. So in every single step, it is vital to have both the African scientists and also the community members that receive these tools involved in the development. And that goes right down to the health workers in communities in the village, trusted people that live in this village, that they know their children live in these villages. And so when these people are trusted to pass on information, to educate the public, it means they have a much larger impact than you would think. So it's going to be very vital in our fight towards really protecting the cure, not to forget that in the world we live in today, information is critical and involvement of affected communities is critical in order not to find ourselves failing to use the wonderful tools that are being developed to help us reach malaria elimination.
Thank you very much. Thank you, Crystal, for your input. And you spoke about trust at the community level. And I think this is also what scientists and community leaders and civil society can work together hand to hand to create that trust and to build that trust. Because many of those innovations, as you spoke on, are also created and developed by African scientists who are doing a lot of work on a daily basis to come up with solutions. So the solutions are often even coming from within the knowledge and the expertise of our local African scientists. And it's very important that communities and civil society start now to work together strongly with the scientists community to increase that trust. So thank you, Crystal, for sharing your thought. We really appreciate that. And we look forward to continue those conversations with you and also to ensure that we can continue to have those strong conversations. So there are some interesting questions in the chat. So one for you, Crystal, is the relationship between the work of African scientists and traditional medicine. And I guess we are in malaria, so we'll stay in the fight against malaria and maybe addressing resistance. So is there a role and a link between African scientists and traditional medicine? And then Dr. Deus, we'll come back to you after for a few questions that we have for Tanzania. So Crystal, tell us what you think about that.
Yes, there's a number of different research paths that people are taking to try and add to the toolbox of fighting malaria. And yes, a popular one within Africa recently has been really saying, can we look a little bit more at our traditional medicines or the hub that we have? So I think part of the challenges that we've had with our traditional medicine in the past is that there's not been a lot of study to look at what the dosage should be. And in some cases, what the active ingredient is, where a community believes that this works, but they don't know why it works, or if it works consistently, or how much of it works, or is it really the one working out of the other herbs they're mixing, and so on. So there are a number of different places where they're really looking at studying that, where they're looking at, is it possible to think about new medications in the future that are still coming from some of these plants. So if you look at a drug like artemisinin, that did come from a plant, actually. So a lot of the medications do, and there is value in that. So personally, I'm an entomologist. I work on the vector side. I look mostly at how can we control the mosquitoes and lead to malaria elimination. But there are scientists that are working also on the pharmaceutical side. And part of what they do is they do study those herbs. And that is where a lot of the new medical formulations actually come from.
Thank you, Krista. We appreciate that. Thank you. So going back to Dr. Dis from the Tanzania Malaria Program. So there's a quick question and comment. There's two questions for you. One is, what are some of the best ways to get communication from scientists and clinicians, those working in the molecular surveillance and those looking at patients' outcome to the national programs? So communication from the molecular surveillance scientists and those working with patients to the malaria programs. So what are some of the best ways to increase that connections and communication between the two? And how has this process and communication gone in Tanzania? And Dr. Zeus, there's another question about what is the new therapy, malaria therapy that is in place in Tanzania at the moment. So Dr. Zeus, over to you.
Thank you, Olivia. I will start with the easiest. That is the new therapy for malaria in Tanzania. At the moment, we don't have any. We are on the watching. So as I mentioned, the program took action based on the data we generated and all the results that have been coming out to make a policy change to replace AL, that is artemether-lumefantrine, with amodiaquine artesunate. And the changes had to be implemented actually from last year. Unfortunately, this has not been done due to PMI funding. And there is another thing I didn't say. We have been doing therapeutic efficacy studies all the way from 2010 until 2024, but we couldn't also do it because of PMI funding in 2025. And even 2026 is still sitting on the fence. So funding has delayed the implementation of policy change to move away from AL, but efforts are being made by the program and the government to ensure we get funding to implement the policy changes. In terms of any new drugs, we don't have any. We are looking for the different options, which our colleague from MMV talked about, and we will be happy to be the first followers in terms of implementing them. For the first question from my friend Machek, basically communicating malaria molecular surveillance to NMCP and other stakeholders is so daunting that not so many people are comfortable at doing it because of the complexity and nature of malaria molecular surveillance terminologies, genomics, bioinformatics. But that is something we think we have done very well, because from the initiation of malaria molecular surveillance in Tanzania, we as researchers did it for NMCP and on their behalf and with them. So we worked in partnership with them. And NMCP in Tanzania actually is the best model that of partnership between different stakeholders, the scientists, research organizations, implementing partners, funding, and others. So I would encourage, and I'm not saying it's the only country that has done well. I know colleagues in Senegal and other countries have done well, but I would encourage people to learn from countries that have done well in partnership, in making good and strong partnership between different stakeholders. So partnership is one of the strategies we have used. Another strategy is stakeholders engagement, including the NMCP. And basically we have made an attempt, and one of our colleagues is doing a study on designing the best model for engaging different stakeholders in the continuum of the research process from the start to the end, up to when the results are made into policy and practices. So we are doing that, but we are trying now to work on the best model. Another thing that we have done, basically in all the work we have done with the NMCP, is making sure that the findings are processed together and feedback given to multiple stakeholders, including the communities and the regions where we have been doing our study. So I think we are doing well, but I'm not sure, and I wouldn't say we are doing much optimally, but we are happy to hear feedback from other countries for more improvements. Over to you.
Yes, thank you very much. Thank you for sharing your experience. There are more questions coming up, so we'll choose one, but please, we'll send you all the other questions by email, because I know your time is also very limited. But the last question is around what do you think, what are some of the actions that Africa can take, African countries can take to slow down malaria resistance without really affecting the access to malaria treatment, and making sure that we continue to have large malaria treatment access. So the question is really about how to prevent the bad use or the overuse of the existing malaria treatment in Africa.
I'm sorry, I'm sorry, I will drag you out of your question. And this is because of the passion and the enthusiasm I have had on eliminating malaria in Africa. Unfortunately, this is getting out of touch. But if you were to ask me what would be the best solution of all this, is eliminating malaria from or eliminating malaria in all countries in Africa and elsewhere. And how do we do that? One of the things I've said, and I will say it again and again, even at a gunpoint, is just eliminate poverty. The moment you eliminate poverty, you have sorted out so many things. Easily said, not easily done, but that would be the best option if it were possible to be done. So in terms of drug resistance, basically, this goes along the same line. We just have to do it as Africans. We don't have any babysitter. We don't have any person around who is going to help us. So it has to be the responsibility of African governments and Africans themselves to face the problem heads on and confront it. If we keep running away from it, the mess will be bigger than we had for chloroquine. So we need to face the problem and solve it steadily, no going back. We have to face it ourselves, and we should not wait for help. We have a lot of things we can do and a lot of resources we can tap on, however little it is, but the little actions African governments can take will most likely sort out lots of troubles and save our population out of the catastrophe that might happen if all the drugs we have fail at the moment. Thank you.
Thank you, Dr. Thank you very much. Exactly, we agree with you. Poverty is one of the biggest issues we have to address as African and get rid of poverty once for all. And we also know that in the meantime, the mosquito won't wait. They are here. They will attack us. So we do need to, like you say, take our responsibility. And maybe this a key recommendation from this webinar is about responsibility, accountability of African actors and leaders about our own problem, and making sure that we prevent this overuse of treatment. Because when we go to the pharmacy or to the doctor, sometimes we just have a fever and they give us malaria treatment without even testing. Or even when we do a test and it's negative, some of us community members are guilty of asking the doctor, give me a malaria treatment, I know it's malaria, even though the test says it's not malaria. So there's so many issues at the community level and in the system that we have to fix. And we have noted those words: responsibility, accountability, and making sure that from now on we will be watching closely this problem, because like you said, if it becomes a much bigger problem, we'll be in a lot of trouble. And I just want to clarify with everyone that malaria treatment, the actual treatment works. They do work, the actual treatment that are recommended by WHO, by your Ministry of Health, by your National Malaria Control Program. Now it's about making sure that we use them correctly and we actually use them in the way that they are supposed to be used. This is very important, and our country will then develop new policy to have a combination of those treatments to prevent eventual future malaria resistance anti-malaria resistance. So the treatment works. We have to use them very well, and we have to use them rationally and making sure that we take our ownership and responsibility around that. So thank you very much. I will try again. We had Emily from Uganda. She had a connection issue, but I don't know if she was able to get back online. This is also some of the reality of Africa is dealing with internet issues. So Emily, if you can hear me, let me know. Let us know if you can hear us. If you would like to take the floor. If you cannot, we'll also try Honorable Elsina. Honorable Elsina, can you hear us? We hope you were able to connect to the internet. Honorable Elsina, if you are here, let us know. If not, we can try again later on. But I will, without any ado, I know we are almost at the end of our webinar, so I would like to first thank all the panelists. Thank you, Crystal from Target Malaria. Thank you, Dr. Zeus from the Tanzania program. Thank you very much for your insight. We really appreciate your time. Now you've watched the first chapter of the documentary, and I have said previously that we need actions. We are all about action now in 2026 and going forward. No more talking and more acting. So I would like to hand the floor to my colleague, Ségolène Moussala. She's going to talk to you about some of the actions you can take. Thank you. Over.
Thank you so much, Olivia. I don't know what's happening with my video, but I hope you all can hear me very well. So I'm going to, I'm very happy to be having the opportunity to present how everyone can engage and join the Protect the Cure movement after everything we have seen and heard today. And as we look at it, this is where the Protect the Cure movement must really start. So we've got a lot of knowledge from experts, and now protecting the cure will rely on what all of us choose to do with the knowledge that we acquired today. And engagement starts with just simple and concrete actions like just watching and sharing the Protect the Cure documentary. So it's available in 3 chapters and 1 animated video. So for the moment, we have 4 videos in the documentary, and they are all in, you can watch them in English, but they're also available with French and Portuguese subtitles, and the animated one even has the 3 different languages. So after there's sharing and watching the video, and there's also how we all amplify it on social media using the hashtag Protect the Cure, so that we can all connect on the content that we share, and we're able to support each other in amplifying it. So share the video, use the Protect the Cure hashtag. There's also an official poster, clips, and messages if you would like to use to easily start the conversation about protecting the cure. You can start the conversation online, you can start the conversation in your community, you can start the conversation at work, everywhere, really to get the word out. So we noticed that there are a lot of journalists, colleagues from media, journalists in the webinar today. We are really happy to have you here because you are also going to be the one to help us get the word out. So if you're a journalist or a reporter, we propose that you report responsibly on resistance and on the use of treatments, that you tell human stories that are related to resistance, not just numbers, not just statistics, but stories like the ones we just watched in the documentary. And also that you create space in media for experts, for parliamentarians, for community voices to really, share insights on how this subject affects us all, especially if you live in the 4 affected countries that were mentioned before. So I hope you can see my screen. There are also a couple social media accounts that you can follow to stay informed about everything related to Protect the Cure. You can follow and tag Impact Santé Afrique ISA and Protect the Cure on social media. We are on LinkedIn, we are on Facebook, we are on Instagram. And also there's a Protect the Cure website. My colleague is going to share the link in the chat, and you can join the website, read everything you need about the movement, about the campaign, messages, videos, everything. And there's also way, apart from journalists, there's also some ways that civil society colleagues, NMCPs, parliamentarians can support this work. So where to start with two simple things per group. For civil society, engage communities with simple and accurate messages from the documentary. Just that would be amazing and huge. Hold systems accountable for access, quality, and surveillance. To NMCPs, we suggest using the documentary for health workers training, and the Protect the Cure team is available for country personalization, for localization of those films, and strengthen communication alongside technical responses. To parliamentarians, we have a lot also in the webinar today. We are asking to champion, sustain malaria financing and oversight of this issue, and support laws and policies that protect treatment efficacy. So this would be like a good starting point for getting the movement in to begin. And over the last months, Impact Santé Afrique with other partners, MMV, Temple University, the Boni Lab, Normalized Pictures, we've been trying to extend the movement. There's been two strategic consultations conducted in Accra during a regional dialogue, and also in Dakar, where we had about 20 countries from West and Central Africa. And these exchanges, they brought together, they were NMCPs, parliamentarians, scientists, civil society actors, some technical partners too. And they came together to identify what are the realistic and coordinated actions that we can actually initiate to anticipate, but also mitigate drug resistance. So we summarized these recommendations, and some of them that we want to share with you. And then this webinar is actually going to be the third consultation. So after that, we are going to have like a good starting point to go forward. And as my colleague, who's going to take the floor, presents the recommendations, we are also going to share a link to the document in the chat so that you can download the recommendations and read them too. It was an honor for me to do this presentation about how to engage in the movement, and I'm going to leave the floor to my colleague to present the recommendations. Thank you. Over to you.
Thank you, Ségolène. So now we're going back to civil society, who will present the recommendation from those previous dialogues on malaria resistance in Africa.
Merci Ségolène, merci Olivia de nous passer la parole. Je suis avec ma collègue Nafissa et nous allons vous présenter les recommandations clés des deux dialogues régionaux que nous avons tenus au Ghana et à Dakar. Donc, pour me présenter, je suis Sorel Ngifo. Donc, je suis programme officer à Impact Santé Afrique qui assure le secrétariat de la plateforme CS4Me, Civil Society for Malaria Elimination. Et j'ai le plaisir d'être parmi vous ce jour. Pour ce qui est des recommandations clés qui ont émergé de ces deux réunions régionales, pour pouvoir anticiper la résistance la résistance antipaludique pour la région de l'Ouest et de l'Afrique centrale, nous avons renforcé la surveillance et l'anticipation à la résistance. Et pour cela, on va dire en gros que nous avons résumé toutes ces recommandations en 7. Donc, pour la première recommandation, on a des grandes recommandations et les activités qui doivent nous permettre de pouvoir réaliser ces recommandations. On a renforcé la surveillance et anticipé la résistance. Et pour cela, il faut établir et renforcer les systèmes de surveillance nationaux et régionaux de la résistance aux antipaludéens. Et ensuite, nous avons également pouvoir assurer la détection précoce des marqueurs de résistance pour pouvoir rapidement adapter les traitements et pour adapter les politiques et les protocoles de traitement. Et ensuite, également, nous avons promouvoir le partage transfrontalier des données et des informations parce que nous le savons tous, la résistance n'a pas de frontières. Donc, il est vraiment important de pouvoir promouvoir le partage des données et des informations transfrontalières. Il faut également développer des mécanismes de surveillance régionaux pour pouvoir permettre une coordination et une réponse plus efficace dans la lutte contre cette résistance. Deuxièmement, il faut également agir de manière proactive en alliant avec les standards internationaux et cela passe par l'adoption des approches proactives pour se rassurer de pouvoir vraiment stopper l'émergence de cette résistance aux antipaludéens. Également, aligner les stratégies nationales avec les recommandations de l'Organisation mondiale de la santé et des évidences scientifiques. Il faut également intégrer la résistance dans les discussions publiques, dans les politiques publiques, pour se rassurer vraiment de pouvoir prendre en compte cet aspect de résistance-là dans le développement des politiques nationales. La troisième recommandation, c'est pouvoir supporter les initiatives thérapeutiques et la recherche. Donc, et pour ça, il faut accélérer le développement et l'introduction des nouvelles thérapies de combinaison en incluant, en combinant plusieurs molécules pour vraiment se rassurer de pouvoir anticiper la résistance au traitement antipaludique. Il faut également explorer les stratégies innovatives. Il faut également intégrer les nouveaux outils de lutte contre le paludisme en incluant la vaccination contre le paludisme et plusieurs autres outils de prévention et de traitement pour se rassurer de pouvoir anticiper cette résistance-là dans les régions où la résistance n'a pas encore pris vraiment de l'ampleur pour pouvoir anticiper. Et aussi, il faut se rassurer de l'accès équitable aux médicaments de qualité parce que pour pouvoir stopper cela, il faut également que les médicaments puisque les patients, que la communauté qu'on donne aux personnes qui souffrent de paludisme puissent être des médicaments de qualité pour pouvoir se rassurer vraiment de pouvoir contrôler cette résistance. Et cela passe également par assurer la disponibilité de ces médicaments de qualité, la sécurité des médicaments antipaludiques, garantir, comme je le disais tout à l'heure, l'accès équitable au traitement, particulièrement pour les populations vulnérables. Il faut également renforcer la régulation pharmaceutique pour se rassurer que les prescriptions médicales correspondent aux normes internationales, aux stratégies des pays, des ordres pharmaceutiques pour se rassurer que tout ce que le personnel médical prescrit comme médicament aux patients soit dans les normes. Donc, je vais directement passer la parole à ma collègue qui est à côté de moi, Nafissa, pour pouvoir présenter la dernière slide des recommandations. Merci. À toi, Nafissa.
Thank you, Soraya, for giving me the floor again. We are going to continue with the key recommendations. Ensure sustainable financing and strengthen governance. Maintain and increase investment in prevention, surveillance, and access to treatment. Strengthen budget advocacy by actively engaging parliamentarians and policymakers. Provide technical support in collaboration with the World Malaria Partnership to End Malaria for the establishment of a centralized medicine procurement unit in the Central African Republic to improve supply chain and input management. strengthen the capacity of health system and stakeholders by building and reinforcing national health system capacities, particularly through continuous training of health professionals. Improve the dissemination and uptake of scientific knowledge by frontline actors, using communication and advocacy tools such as the Protect the Cure documentary to train and raise awareness among community health workers. Strengthen community engagement and multisectorial collaboration by raising community awareness on the importance of completing full treatment courses. Strengthen community engagement in malaria prevention and case management, including among adolescents, and encouraging multi-sectoral collaboration across health research in sectors. Those are the other recommendations that was wrapped up. Now I'm going to give the floor to Olivia. Olivia, back to you. Thank you.
Yes, thank you, Nafisa. Merci, Nafisa. And over to Ségolène.
Thank you so much, Nafisa and Sorel, for sharing these recommendations. But a big thank you too for all the colleagues, partners, experts, scientists that have been engaged over the last months to share these, which are very important to follow up starting now. So again, we shared the link to the recommendations in the chat, so feel free to read and share and reach out to us if you would like to be a part of this. We are also putting out a special calls for all participants here to organize Protect the Cure screenings in their countries, amplify the communication materials of the movement. So maybe even if you are journalists interested in organizing a screening for other journalists in your country, NMCPs, I saw we also have a lot of medicine students here. Really, we are all concerned about this, so feel free to reach out to us, and we are going to plan for this. We are also going to let our email contact in the chat. So now we have gone through like almost all of the whole agenda, and we are now starting the closing. So it's my very, very, very pleasure to introduce one of our honorable champions. She's a parliamentarian from Uganda, but she is also the co-chair of the Coalition of Parliamentarians to End Malaria in Africa, COPEMA. Her name is Honorable Santa. She's a very dedicated politician, and she advocates for women's and children's rights. So we are going to hear from Honorable Santa now. Please, Hugo, if you are ready.
Dear distinguished colleagues, partners, and friends, my name is Santa Okot, a member of Uganda Parliament, a co-chair coalition of parliamentarians to end malaria in Africa. I'm making here a closing remark of the African dialogue on the urgency to protect the cure. As we conclude this dialogue, I would like to thank all our speakers and participants for the clarity and urgency of today's discussions. I would also like to congratulate the Protect the Cure team for this timely documentary. One message stands out clearly. Malaria drug resistance is no longer a future risk. It's a present danger. If we fail to protect the medicine that saves lives today, we risk reversing decades of progress tomorrow. In Africa, where the burden of malaria is highest, the cost of inaction will be paid by our children, our health system, and our economies. As parliamentarians, our roles are very clear. We must ensure sustained and predictable financing for malaria responses. We must demand strong surveillance and data-driven decision-making. And we must use our oversight and legislative powers to hold systems accountable and protect communities. Today's dialogue reminds us that evidence exists, solutions are emerging, and partnerships are strong. What is needed now is leadership. Leadership that turns science into policies and policies into impact. On behalf of COPEMA, I reaffirm our commitments to working with governments, civil society, researchers, and partners to act with urgency and unity to protect the cure. I want to thank you for your engagement and for carrying this message forward. Thank you very much.
Thank you very much. Thank you. Thank you all. Thank you, Honorable. Really warm thank you to Hugo Berkeley. You haven't seen him, but he was really important and tremendous in helping us organize this webinar. And he's also the master behind this beautiful documentary together with Prof. Maciet Boni. So thanks, really. Now. Yeah, we can see you, Prof. Thank you very much. Thank you for your time. We appreciate that. This was we have received a lot of messages from all over Africa around the fact that they appreciate the documentary, but also they appreciate the key information shared in this webinar. So now we need to go from appreciation to action. Now you have the knowledge. Knowledge is power. Please share widely. We have sent all the links in the chat. We will share them by mail. But what we need to do now is to act and share those informations, those documentaries, those animated videos, the key messages in your networks. And we will go on to continue to combine that long list of recommendations. So also feel free to email us. We'll drop our email in the chat. Feel free to email us with your recommendation after this webinar and making sure that we can also capture your voice, your recommendation, and then compile everything for the summary of this webinar. So I just want to thank also the whole team of Impact Santé Afrique and all the CS Committee, civil society organizations who were connected today. Of course, to all our honorable parliamentarians from many countries in Central Africa, Eastern Africa, and West Africa who joined us today. So thank you, honorable parliamentarians, and all the partners, all the speakers, and the presenter. Without you, we couldn't have this webinar. So thank you very much to all of you. And we will look forward. This is our first webinar on this topic, but we're going to have many more conversations with all of you at the global level. So we look forward to our next conversation. But in the meantime, please do share the information widely and help us to engage community around the best practices so we can tackle and really push back malaria resistance. So thanks all our partners, RBM, WHO, MMV, Target Malaria, COPEMA, everybody. Thank you and have a good rest of the day. Thank you all.
Bye.
Thank you. Goodbye. Thank you, everybody.